Do you ever wonder if the way you sleep can change your health? It might seem like a small choice, but sleeping position can make a big difference. Scientists and doctors have studied sleep for years. Their research shows that the way you rest each night can affect your body in surprising ways. Many people don't think twice about how they fall asleep, but sleep position can impact breathing, digestion, and even how your back feels when you wake up. Some people find that switching positions help solve long-term health issues. Others feel best sticking with what feels natural. So, should you change how you sleep, or is comfort the only thing that matters? Let's dive into the science behind sleep positions. We'll explore how each one affects your health and how to choose what's best for you. People sleep in many different ways. The most common positions are on the side, on the back, or on the stomach. Some curl up like a ball, while others stretch out long. A few people even toss and turn between positions during the night. Studies show that about 60% of adults sleep on their side. Back sleepers make up about 30%, and the rest prefer lying on their stomachs. Each position has its fans and critics. Sometimes people switch as they age or when life changes, like pregnancy or injury, affect comfort. No single position is right for everyone. What feels comfortable for one person may be painful for another. Allergies, body shape, and even mattress type can play a role in what works best. It's important to know the basics of each position. This knowledge can help you understand your own sleep and make small changes for better health. Why do doctors care about how we sleep? The answer is simple. Sleep position affects our breathing, digestion, spine, and long-term health. When you lie down, gravity and body weight change how your organs and muscles line up. For example, your airway can close more easily in some positions, leading to snoring or sleep apnea. This interrupts deep sleep and can cause health problems over time. Digestion too can slow down or speed up depending on how your stomach is positioned. The spine is another key player. If your back is twisted or bent, you may wake up with pain. A poor sleep position night after night can even lead to chronic issues, but a well-chosen position supports the natural curve of your spine and keeps your body in balance. Knowing these facts helps you make smarter choices. Even small changes can protect your health and make sleep more restful. Side sleeping is the most popular position worldwide. In fact, studies show that more than half of adults naturally prefer to sleep on their side, whether curled up in the fetal position or stretched out. This position feels instinctively comfortable for many people, and it's often the go-to choice after a long, tiring day. Scientists have found that side sleeping offers several important health benefits, making it more than just a matter of comfort. Researchers have spent years studying how our sleep positions affect our bodies, and side sleeping consistently stands out for its positive effects. For many people, sleeping on the side helps keep the airway open and reduces snoring. This is especially helpful for those who share a bed, as it can lead to quieter, more restful nights for everyone. By preventing the tongue and soft tissues from collapsing into the throat, side sleeping can make breathing easier. It also helps prevent sleep apnea, a serious condition where breathing repeatedly stops and starts during sleep. Side sleeping can lower the risk of these dangerous interruptions, leading to better oxygen flow and improved sleep quality overall. Another big benefit of side sleeping is its positive impact on digestion. People who experience bloating or discomfort after eating may find relief by lying on their side, especially after a heavy meal. Lying on the left side, in particular, allows gravity to help move food from the stomach into the intestines more efficiently. This position can also help the body process waste and absorb nutrients better, making it a smart choice for digestive health. This can reduce acid reflux and heartburn, which are common problems for many people. By keeping stomach acid lower in the digestive tract, left side sleeping can help prevent that uncomfortable burning sensation and promote a more peaceful night's rest. Pregnant people are often advised to sleep on their left side to improve blood flow to the baby and kidneys. This position can also help reduce swelling in the legs and feet, and it's considered the safest way to sleep during pregnancy for both mother and child. But side sleeping isn't perfect for everyone. Some people find it difficult to stay comfortable all night and may toss and turn or wake up feeling sore. Some people wake up with numb arms, shoulder pain, or hip discomfort. This is often due to the pressure placed on certain joints and nerves while lying on one side for hours at a time. This happens if your weight presses down on nerves or joints, cutting off circulation or causing tingling sensations. Over time, this can lead to soreness, stiffness, or even chronic pain if not addressed. Over time, this can cause soreness or tingling, making it harder to get a good night's sleep. It's important to pay attention to your body and make adjustments if you notice discomfort. If you are a side sleeper, using a supportive pillow between your knees and a firm mattress can help keep your spine straight. This simple adjustment can make a big difference in how you feel in the morning. This reduces pressure on your hips and shoulders, keeps your spine aligned, and makes sleep more comfortable. With the right setup, side sleeping can be both healthy and restful, helping you wake up refreshed and ready for the day. Back sleeping is often recommended by doctors for its excellent support of the spine and overall body alignment. This position is considered one of the healthiest ways to rest, especially for people who want to maintain good posture even while they sleep. Doctors and sleep specialists frequently suggest back sleeping for those who experience chronic back pain or want to prevent future discomfort. When you lie on your back, your head, neck, and spine stay in a neutral position, which means there's less strain on your joints and muscles. This alignment helps distribute your body weight evenly, reducing pressure points that can cause pain or stiffness in the morning. As a result, back sleeping can help prevent back and neck pain, and many people find they wake up feeling more refreshed and pain-free. It's especially beneficial for those who suffer from tension headaches or tightness in the shoulders, as it minimizes awkward angles during the night. Some experts say it's also the best position for keeping your skin smooth, since your face isn't pressed into a pillow. This can help reduce the risk of developing sleep lines and wrinkles over time, and may even help prevent breakouts caused by pillow friction or bacteria. However, back sleeping isn't for everyone. Some people find it uncomfortable or have trouble falling asleep in this position, especially if they're used to sleeping on their side or stomach. It can take time to adjust, and some may never feel fully at ease lying flat on their backs. People who snore or have sleep apnea may find their symptoms get worse when sleeping on their backs. This is because gravity can cause the tongue and soft tissues in the throat to relax backward, partially blocking the airway and making breathing more difficult. This airway obstruction can lead to louder snoring, frequent awakenings, or even pauses in breathing during the night, which can be dangerous if left untreated. For these individuals, side sleeping is often a safer and more comfortable choice. Those with acid reflux may also notice more heartburn when lying flat on their backs, as stomach acid can more easily flow back into the esophagus. Elevating the head or sleeping on the left side may help reduce these symptoms. Back sleeping can be made much more comfortable if you use a supportive pillow under your knees. This small adjustment helps maintain the natural curve of your lower back and can relieve tension in the lumbar region. By reducing pressure on your lower back, a pillow under the knees can make back sleeping more accessible for people with mild discomfort or those transitioning from other sleep positions. If you have chronic pain, trouble breathing, or any ongoing sleep issues, it's always a good idea to talk to your doctor before making back sleeping your main position. A healthcare provider can help you determine what's safest and most comfortable for your unique needs. In general, healthy adults without breathing problems or acid reflux may do very well sleeping on their backs. This position can promote restful, restorative sleep and help you wake up feeling energized, but it's important to listen to your body and make changes if you notice any discomfort. Everyone's body is different, and the best sleep position is the one that helps you feel your best each morning. Don't hesitate to experiment with pillows, mattress firmness, or even slight adjustments to your position until you find what works for you. Stomach sleeping is the least common and least recommended position by sleep experts. Despite how natural it might feel for some, it's actually considered the most problematic way to rest through the night. When you lie on your stomach, your body weight presses down on your spine, flattening its natural curve. This position can put extra pressure on the muscles and joints, making it harder for your body to maintain proper alignment. As a result, you're more likely to wake up with lower back pain, stiffness, or even numbness in your limbs. Over time, this can lead to chronic discomfort and make it harder to get restful sleep. Another major issue is that your neck has to twist to one side for hours at a time, just so you can breathe. This unnatural position puts a lot of strain on your neck muscles and joints. That's why many stomach sleepers wake up with neck pain or headaches that can last all day. Over time, this can even lead to long-term neck problems or reduced mobility. Breathing can also become more difficult, since your chest is pressed tightly against the mattress. This can restrict your lungs and make it harder to take deep, comfortable breaths while you sleep. For most people, these risks far outweigh any potential benefits. Sleep experts almost always recommend other positions for better spinal health and overall comfort. Still, there are a few rare cases where sleeping on your stomach can help. Some people find that this position reduces snoring, especially if they have mild sleep apnea or airway issues. By keeping the airway slightly more open, stomach sleeping can sometimes make breathing easier for certain individuals. However, this benefit is uncommon and doesn't apply to most people. Even with this rare advantage, the drawbacks of stomach sleeping usually outweigh the positives. Most doctors and sleep specialists do not recommend it as a long-term solution. If you absolutely can't sleep any other way, try using a very thin pillow or no pillow at all under your head. This helps keep your neck in a more neutral position and reduces the risk of pain. You can also place a thin pillow under your hips to further support your spine and minimize strain on your lower back. Ultimately, most experts suggest gradually training yourself to sleep on your side or back. These positions are much better for your spine, neck, and overall health, and can help you wake up feeling more refreshed and pain-free. Many people ask, what's the best way to sleep? The truth is, there's no one-size-fits-all answer. The best position is the one that keeps your spine straight, your airway open, and your body comfortable. Age, health conditions, and pregnancy can all change what's right for you. For example, side sleeping may work better during pregnancy, or for people with acid reflux. Back sleeping might help those with joint pain. But if you have sleep apnea or snore loudly, back sleeping might make things worse. The key is to listen to your body. Notice how you feel in the morning. If you wake up with pain or discomfort, it may be time to try a new position. Remember, small adjustments can make a big difference over time. Doctors agree. Comfort, spinal alignment, and breathing are the top priorities. Don't worry about trends or what others say is best. No matter how you sleep, there are ways to make your rest healthier. Start by choosing the right pillow. Side sleepers often need a thicker pillow to support the neck. Back sleepers do best with a medium-height pillow. Stomach sleepers should use a very thin pillow, or none at all. A good mattress supports your body's curves and keeps your spine aligned. If your mattress is too soft or too hard, it can cause pain. Many people find a medium-firm mattress is best, but personal preference matters. Small changes help too. If you sleep on your side, place a pillow between your knees. Back sleepers can put one under their knees. Pregnant people may benefit from extra pillows for support. If you often wake up sore, try adjusting your sleeping position a little at a time. Most of all, focus on keeping your spine straight and your breathing easy. Comfort leads to better, deeper sleep. Science tells us that sleep is vital for health, and how we sleep matters, but there is no perfect position for everyone. The best approach is to pay attention to your own body. Notice what helps you breathe deeply and wake up pain-free. Prioritize spinal alignment, open airways, and comfort. Don't feel pressured to follow trends or force yourself into a position that doesn't feel right. Instead, make small changes and see what works best for you. Better sleep leads to better health, mood, and energy. With the right position and support, you can wake up feeling rested and ready for the day. Remember, healthy sleep is a journey, not a destination. Trust your body, make adjustments as needed, and enjoy the many benefits of a good night's rest.